Have you ever felt a strange tingling in your arm that vanished after a few minutes? Or noticed your speech slur slightly when you were just feeling tired? What if those tiny signs were more serious than they seemed? Stroke is one of the leading causes of disability and death among older women in the United States. What's most alarming is that the early symptoms in women often differ from those in men and are easier to overlook. According to the CDC, nearly 60% of stroke deaths occur in women, partly because symptoms can appear milder, less specific, or simply misread as fatigue or stress. This silent onset means that many women lose precious time before seeking help. Welcome back to the channel. Today we will explore a very important topic for health, the early signs of stroke in senior women. Understanding these signs isn't just helpful, it's life-saving. Some symptoms may surprise you. Some may have even happened to you or someone you love. In the comments, have you or someone close ever experienced a mini stroke or unexplained neurological symptoms? Let's talk about it below. In the next section, we'll explore the first visible clue that something might be wrong, a change in the face. Section 2, Facial Drooping, How to Notice and Act Fast. One of the most recognizable early symptoms of a stroke is facial drooping, yet it can be deceptively subtle, especially in women. This is why learning what to look for and how to test it quickly is so essential. Imagine you're looking in the mirror, brushing your teeth, and you suddenly notice one side of your mouth isn't moving quite like the other. Or you smile for a photo, and your loved one says, "Wait, your smile looks uneven." That could be more than just fatigue or aging. It could be your body warning you of a stroke. Why it happens? Facial drooping occurs when a stroke affects the part of the brain that controls the muscles of the face. This usually results in muscle weakness or paralysis on one side. The droop can affect the mouth, cheek, and sometimes even the eyelid. While this sign is common in both men and women, women may experience it along with nausea or general malaise, making it easier to dismiss. Quick test, think FAST. This is where the acronym FAST comes in, a life-saving memory tool. F for face, ask the person to smile. Is one side drooping? A for arms, can they raise both arms equally? S for speech, is their speech slurred or strange? T for time, if you see any of these signs, call 911 immediately. Studies show that people who receive treatment within 3 hours of the first symptoms often recover with significantly fewer complications. Yet many wait too long, especially women, who may second-guess or brush off the signs as anxiety or tiredness. A story to remember. Let's look at a real example. Margaret, 71, from Ohio, was enjoying her morning coffee when her daughter noticed something odd. Margaret's smile looked uneven. She felt fine, just a bit tired, but her daughter insisted on calling 911. At the hospital, doctors confirmed she was having a minor stroke. Thanks to her daughter's quick thinking, Margaret received clot-busting medication within 90 minutes. Today, she has no lasting effects. What saved Margaret was not just medical treatment, it was the ability to notice a subtle change and act fast. Facial changes, not always obvious. Here's the key. Not all facial droops are dramatic. It could be a slight flattening of the cheek when smiling or an eyelid that seems to sag more than usual. In some women, it may not be visible to them, but others around them will spot the difference. That's why education and observation from loved ones are just as important as personal awareness. Don't wait it out. Sometimes people wait to see if symptoms go away on their own, but with stroke, every second counts. The brain loses about 1.9 million neurons each minute during a stroke. Waiting an hour can make a life-altering difference. If you care for an older woman, your mother, your spouse, a neighbor, pay attention to her expressions. If her smile looks different or you hear a slur in her words, gently ask her to perform the FAST test with you. Even if she insists she's fine, trust your instincts and seek help. In the next section, we'll talk about something many women experience daily: arm or leg weakness. Is it just arthritis or something more? Section 3, Arm or leg weakness. Even mild weakness can be critical. Let's talk about a symptom that's often mistaken for just getting older: sudden weakness in an arm or leg. How do you know when that familiar heaviness or shakiness is a warning sign, and not just arthritis or fatigue? For many senior women, this symptom sneaks in quietly. You may wake up and notice your arm feels unusually weak, or that one leg seems to drag slightly when walking. It's easy to dismiss it as stiffness or overexertion. But in the context of a stroke, this kind of weakness is anything but normal. How it works in the brain. During a stroke, the blood flow to part of the brain is blocked or interrupted, depriving cells of oxygen. If the area affected controls movement, you'll feel it almost instantly, usually on one side of the body. That's why one-sided weakness or numbness is such a critical red flag. It may appear as difficulty lifting one arm, even halfway, a hand that suddenly struggles to grip or hold objects, a leg that feels heavy or off balance when walking. Why it's different in women. Here's where it gets tricky. Women may experience more subtle or diffuse symptoms like weakness accompanied by lightheadedness or nausea. They might say, "I just feel off," or "My hand's being clumsy today." But these small signs may be the brain's cry for help. In fact, a 2023 study published in Stroke Journal found that senior women often present with non-traditional stroke symptoms and are less likely to receive immediate attention because of it. A moment of truth. Consider Darlene, a 66-year-old retired teacher. One morning, while watering her garden, she dropped the hose from her right hand. It felt like jelly. She brushed it off, thinking she had slept funny on her arm. But when she tried to kneel, her right leg buckled slightly. She called her daughter, who immediately recognized the signs and rushed her to the hospital. The diagnosis? A transient ischemic attack, or mini-stroke. Because she acted fast, Darlene avoided a full stroke and started medication that has since kept her healthy and independent. A simple home test. Try this yourself or with a loved one. Hold both arms out in front of you with your eyes closed for 10 seconds. If one arm drifts downward or feels much weaker, don't ignore it. This test can reveal weakness that might not be obvious during daily routines. When weakness isn't pain. A key distinction. Stroke-related weakness is not usually painful. It's more like a sudden power outage in the muscles. If your joints hurt but your muscles still feel strong, it may be arthritis. But if your strength disappears without pain, especially on one side, get checked. Don't rely on willpower. Some women pride themselves on pushing through discomfort. That inner resilience is powerful, but in this case, it can be dangerous. Stroke symptoms will not improve with rest or time. If anything, they may worsen quickly. And remember, time lost is brain lost. Up next, we'll explore how speech problems and confusion can be overlooked or misunderstood in women, yet signal a very urgent threat. Section 4. Speech and confusion. Trouble finding words or sudden disorientation. Have you ever had a moment where your words just didn't come out right? You knew what you wanted to say, but the sentence sounded jumbled or nothing came at all? For many senior women, these moments are brushed off as senior moments, but sometimes they're much more serious. Speech and language problems are among the most telling early signs of a stroke, yet they can often be misunderstood, especially in women who may experience additional symptoms like fatigue or anxiety that cloud the picture. What's happening in the brain? The brain's left hemisphere typically controls language for most people. When a stroke hits this area, it can affect how you form words, understand speech, or even recognize written language. This is called aphasia, and it shows up in different ways. Slurred or garbled speech. Speaking real words that don't make sense. Trouble understanding what others are saying. Complete inability to speak despite being conscious. Confusion versus forgetfulness. Many older women fear memory loss or dementia, but stroke-related confusion comes on suddenly. You might forget your address, struggle to follow a simple conversation, or feel disoriented in a familiar place. This is not gradual decline. It's rapid and alarming. Confusion paired with speech changes is an emergency. Why women may delay help. Women often downplay these symptoms. A common response is, "I'm just tired," or "I've had a lot on my mind." But stroke doesn't wait for you to rest up. If your speech suddenly changes or you feel mentally foggy, it's crucial to act. What's more, women tend to be more isolated socially, especially after retirement or widowhood. That means there's no one around to notice the slurred words or unusual silence. Real case, the phone call that saved her Patricia, age 72, was chatting with her granddaughter on the phone when her words became garbled. She was fully awake, but her sentences stopped making sense. The 14-year-old noticed something was wrong and hung up to call 911. When paramedics arrived, Patricia couldn't recall her name or birthday. She had suffered a stroke. Thanks to that quick action, Patricia recovered with only minor speech therapy. But had she been alone, the outcome could have been very different. What to listen for. If you or a loved one suddenly can't find common words, speak gibberish or use incorrect words, struggle to repeat a simple sentence, ask the same question multiple times within minutes, these are not normal aging signs. These may be neurological alarms. Important reminder for families, don't just ask, "Are you okay?" Ask them to say a complete sentence like, "The sky is blue today." If it comes out jumbled, that's a red flag. This quick test can reveal more than just stress or tiredness. It may save a life. In the next section, we'll explore vision and balance problems, two symptoms that often get blamed on aging, but may point to something far more urgent. Section 5. Vision and balance issues. Blurry vision, dizziness, or stumbling. You're walking down the hallway, and suddenly the world tilts a little. Or you notice the words on the page blur for a moment before snapping back into focus. Maybe you've stumbled slightly, thinking your shoe caught the rug. But what if your brain was the real culprit? Changes in vision or balance are classic warning signs of a stroke, especially when they come on suddenly. And for senior women, these symptoms are often misattributed to aging, dehydration, or vertigo. Stroke and the brain's navigation system. Different parts of the brain control vision, coordination, and balance. When a stroke affects these regions, the result can feel like sudden double vision or loss of sight in one or both eyes, dizziness or a sensation that the room is spinning, loss of coordination, even when sitting or standing still, unsteady walking, veering to one side or bumping into objects. These aren't just signs of getting older. They can be the first signs that blood flow is being restricted to the brain. A common misdiagnosis. Many women report these symptoms to their doctors and are told it's inner ear trouble or dehydration. While those are valid causes, if the onset is sudden and paired with other symptoms, don't wait. Women in particular may be underdiagnosed or misdiagnosed because their symptoms can appear vague or nonspecific. A 2021 report by the American Stroke Association revealed that women are 33% more likely than men to experience non-traditional symptoms, and this leads to dangerous delays in treatment. Story. The misstep that mattered Eleanor, 69, was shopping at the farmer's market when she suddenly felt dizzy and had to sit down. She thought she hadn't eaten enough and sipped some water. Then she realized her vision in one eye was blurry. Still, she insisted on driving home. A neighbor noticed she was veering in the parking lot and intervened. At the hospital, they confirmed a stroke in her cerebellum, the part of the brain that controls balance. She hadn't recognized the signs until it was almost too late. What to look for? Ask yourself or a loved one, is this a new sensation, not something you felt before? Did it come on suddenly, within minutes or hours? Are you feeling off balance even when sitting? Is your vision acting up in one eye or both? One quick test is to stand still, feet together, arms by your side, and close your eyes. If you begin to sway significantly or feel like falling, this may be more than just fatigue. The power of observation. Because these symptoms don't always feel serious, they're often ignored. But they should never be dismissed, especially if they occur in combination with facial changes, speech issues, or limb weakness. If you see someone stumbling or struggling with balance or vision, don't just offer them a hand, offer to call for help. Fast action is more valuable than polite hesitation. In the next section, we'll discuss a group of symptoms that often get overlooked because they feel so common: fatigue, nausea, and headaches. Section 6. Unexplained fatigue, nausea, and headache, often dismissed but dangerous. I just don't feel like myself today. It must be the weather, or something I ate. Sound familiar? These are the types of phrases many older women use when they're feeling unwell. And while those feelings might seem minor at first, they could actually be early signs of a stroke, especially when they appear suddenly and without clear cause. Let's explore 3 symptoms that often go unrecognized: fatigue, nausea, and headaches. All 3 are common in women and can easily be brushed aside, yet they often show up in stroke cases, sometimes as the only warning signs. Fatigue, more than just being tired. It's normal to feel worn out after a long day, But stroke-related fatigue is sudden, overwhelming, and inexplicable. You might feel drained even after resting well, like your body is shutting down, weak all over without exertion. In stroke cases, fatigue can be a result of the brain working under distress. Blood flow interruption taxes the nervous system, making the simplest tasks feel exhausting. It's not the same as tiredness after activity. It's like a heavy fog has settled over your body. Nausea and vomiting. Surprisingly, nausea and even vomiting can be symptoms of a stroke, especially when the brainstem is involved. The brainstem controls many involuntary functions, including balance and digestion. When a stroke strikes this area, it can create symptoms similar to motion sickness, food poisoning, inner ear problems. Women are particularly likely to report nausea during stroke, and it is often misdiagnosed as the flu or anxiety. That's why knowing your body and spotting what's unusual is so vital. Headaches, the different kind. A stroke headache is not like a normal tension headache. It is sudden and intense. Some describe it as a thunderclap, often localized to one side, sometimes accompanied by vision issues or neck stiffness. If you're someone who rarely has headaches and you suddenly develop a severe one along with confusion or fatigue, don't wait it out. It may not be a migraine. It could be a brain hemorrhage or ischemic stroke in progress. The pattern women should watch for. Women are more likely to experience these non-traditional stroke symptoms, especially if they have high blood pressure, atrial fibrillation, or a history of migraines. But these symptoms also occur in women without major risk factors. That's why it's important to look for patterns. Did these symptoms appear out of the blue? Are they paired with other changes, speech, vision, weakness? Do they feel off from your usual version of fatigue or nausea? A story of awareness, Linda, 74, began her day feeling off. She couldn't finish breakfast. Her stomach turned and her head ached. She assumed it was something she ate, but her husband noticed she was slurring her words and urged her to lie down. Thankfully, he later decided to call 911. At the ER, doctors confirmed a posterior circulation stroke. If he hadn't acted, Linda might not have survived. Trust your intuition. Senior women often have excellent instincts, but may be conditioned to downplay symptoms. If something feels deeply unusual in your body, don't hesitate to get help. You don't have to be sure to act. It's better to rule out a stroke than to miss the window for treatment. In the next and final symptom section, we'll talk about neck pain and persistent hiccups. Strange but important warning signs many don't associate with stroke at all. Section 7. Neck pain or persistent hiccups. Unexpected warning signals. You might be surprised to learn that something as simple as persistent hiccups or neck pain could be an early warning sign of a stroke, especially in women over 50. These symptoms are rarely talked about, but they're real, and they matter. Why do they happen, and when should you worry? The mystery of persistent hiccups. Hiccups are usually harmless and brief, but if you suddenly develop repetitive, prolonged hiccups, especially if they come with other stroke-like symptoms, it could signal a problem in the brainstem, the area of the brain responsible for automatic body functions like breathing, heart rate, and yes, hiccups. In women, brainstem strokes often present with non-traditional symptoms, hiccups that won't stop for hours, sudden nausea or vomiting, difficulty speaking or swallowing, unexplained fatigue or confusion. These are signs that something is affecting the body's control center. Because they're unusual, they often delay diagnosis. Why neck pain could be a red flag. Neck pain is common, often from arthritis or sleeping wrong. But when caused by a stroke, it feels sudden, sharp, and deep, and may be located on one side only. This could indicate a dissection of the carotid artery, a tear in one of the main vessels supplying blood to the brain. In rare cases, this tear leads to an ischemic stroke. What's more concerning is that this type of stroke disproportionately affects middle-aged and older women and is sometimes triggered by simple movements, like tilting the head or stretching too hard. Be cautious if neck pain appears with no known cause. It's accompanied by headache, vision changes, or weakness. You also have trouble speaking or feel dizzy. Case in point, a hiccup that saved a life. Jeanette, 68, experienced persistent hiccups during lunch. She laughed it off, but they didn't stop for over an hour. Her daughter noticed Jeanette seemed groggy and had a hard time answering questions. When her speech slurred, they went to the ER, and it turned out to be a brainstem stroke. Because they sought help quickly, Jeanette received clot-busting treatment and recovered without major complications. Overcoming "it's nothing" thinking. One reason these symptoms get missed is because they seem unrelated to the brain. A hiccup doesn't scream emergency, and neck pain is almost expected in older adults. But when viewed in context with fatigue, speech changes, vision trouble, they become vital clues. Many women feel pressure to be strong, to not overreact. But this strength can come at a cost. Listening to your body doesn't mean being dramatic. It means being wise and proactive. When to act. If you or someone you love has persistent hiccups lasting over 30 minutes, sudden, sharp neck pain with no injury, these symptoms, along with confusion, speech slurring, or dizziness, call 911. These might be signs of a posterior circulation stroke, a type of stroke that is often harder to recognize but equally dangerous. We've just explored 7 early stroke symptoms in senior women, many of which are subtle, unexpected, or easily dismissed. Let's briefly reflect on what we've learned. Facial drooping. Even slight asymmetry or a crooked smile should never be ignored. Arm or leg weakness. Sudden, one-sided weakness is a neurological emergency. Speech and confusion. Trouble finding words or sudden disorientation can be the first signs. Vision and balance issues. Blurry vision, dizziness, and clumsiness aren't always harmless. Fatigue, nausea, and headache. Unexplained body signals that may precede a major stroke. Neck pain and hiccups. Strange but medically documented clues of brainstem involvement. The silent signs. Many strokes begin quietly, especially in women. Early recognition saves lives. Each of these symptoms, on their own, might not seem urgent, but together, or if they appear suddenly and without cause, they point to something serious. That's why it's crucial to know your body, listen to your intuition, and never second-guess taking action. Stroke can change a life in minutes, but with early recognition, we can prevent the worst outcomes and often reverse damage altogether. Your healthcare reminder. Healthcare is a daily journey. It doesn't have to be perfect. It just has to be consistent. A well-balanced diet, regular walking, keeping blood pressure in check, and knowing the signs of stroke. These are your everyday superpowers. You don't need to be a doctor. You just need to stay aware, stay calm, and act fast. If you experience or witness these symptoms, don't wait to see if they go away. Call 911. Seconds matter. If you found this video useful, please share it with your loved ones. Subscribe to the channel to be a companion every day. Your health story continues, and we're here for every step.